Good morning and welcome to today's course. My name is Nathaniel Watkins and I'm an instructor with EMS Safety Services. In this section, we would have a discussion about the CPR skills overview. The main objective of this section is to be able to learn the importance of good, high-quality chest compressions. Following the overview, we will demonstrate some skills, hands-on skills practice of doing chest compressions. In this section, there are 4 main points. The first one is to be able to push hard, push fast, minimize chest compression interruption, and being able to know not to lean on the chest. So let's break it down. Being able to push hard. What is the depth of chest compressions? Well, the latest curriculum from 2015 suggests that we compress adult chests at least 2 inches the depth of the chest. How do we know we're in the correct location for chest compressions? Well, the guidelines and curriculum says that it's just between the nipple line. So if you place your hands just between the nipple line and you begin to compress on the chest, you must remember that the depth of chest compression is at least 2 inches the depth of the chest. You can find this information that I'm discussing in your books on page 11 to follow along. So, when you find the correct hand location for chest compression just between the nipple line, you compress the chest at least 2 inches the depth of the chest. It's important to remember, however, in between every chest compression, that you allow full chest recoil. What's the importance of full chest recoil is to be able to allow the heart to adequately fill back up with blood, so with the next compression, an ejection fraction of blood would adequately be able to be ejected from the heart. The second point is to be able to remember to maintain the rates of chest compressions. So pushing fast is very important, but you don't want to push too fast. So the guidelines suggest that we compress the rates of a minimum of 100, but no more than 120 compressions per minute. It's been found that if you compress at a rate greater than 120 compressions per minute, that you might not be compressing the adequate depth. And again, what is the depth of chest compressions? That's correct, at least 2 inches the depth of the chest. So remember to maintain that rate, a minimum of 100 and a maximum of 120, absolutely. The next main point that's emphasized in this section is to minimize interruptions. What are some things that might interrupt chest compressions? Well, it could be the application of the AED, or either stopping compressions to provide the 2 breaths. So it's important that after you provide the compressions and you stop to deliver the 2 breaths, or either to apply the AED, that we minimize chest compression interruption to less than 10 seconds. And the reason why that's important is because when we stop compressing the chest, which is the most important part of CPR, chest compressions, there's no flow of blood, and so we stop that, and it decreases and minimizes perfusion. So it's important that when you stop the compressions and you go to deliver those 2 breaths, or to apply the AED, you're going to make sure that you minimize interruption to less than 10 seconds. The last main point in this section is to make sure that you do not lean on the chest when you're providing those chest compressions. So when you're providing those chest compressions, you want to make sure that your hands are in the correct location. And what did I say that was? Just between the nipple lines, absolutely. So when you apply the chest compression, you want to make sure that you're allowing full chest recoil by allowing the chest to rise back to its normal anatomical shape. So you remove your weight, but you don't remove your hands. And you also want to make sure that you're not bouncing on the chest as well. And again, you will all have an opportunity to be able to practice these skills of this overview which we are discussing. So remember, in this section, it's important that you make sure you remember to push hard. What is the depth of chest compressions? At least 2 inches. Push fast. That's referring to the rate. What is the rate of chest compressions? Absolutely, 100 to 120 per minute. You want to make sure that you minimize interruption, and we don't want to interrupt chest compressions more than how many seconds? You're right, 10. And why is that important? Absolutely, because it affects perfusion. And lastly, you want to make sure that you're not leaning on the chest. And we make sure that we do that by not removing our hands, and we avoid bouncing on the chest. Now we will begin to be able to practice these skills and put into play what we just reviewed on page 11 of your books.